one of the fastest growing areas in our practice is the male facelift. I think there's a number of reasons for that. Part of it is the last couple of years with all these Zoom meetings, people are a little more aware of how they look, and I think that's definitely had a bearing on that. I think also, whether they're working at a job or doing charity work or whatever, they want to look their best. They want to look vital. They want to look energetic. Sometimes the problem is, you think of some of these stereotypical results where faces have been distorted. And people are off put by that, of course, but really when it's done well, you should be paying attention to the natural facial identity. What I basically do is, study pictures of all my patients from 5 years ago, 10, 20, etc., so I can really keep that natural dynamic. So we offer a lot of different options for our male facelift patients. Obviously, someone who has a lot of structural descent, we're going to do the traditional neck and jaw border lift, which makes incisions around the ears. And it's not just about lifting the skin, but bringing up the deeper structures to the proper location. We do virtually all of those under local anesthesia. What we're doing lately, which is really neat, especially for people who wear their hair very short or maybe shave their heads, is in the right patient, there's a technology called MyElevate. It's where we just make tiny openings in the skin, and it's possible to release the tight bands of the muscle and then weave a supporting network of sutures, much like we would do with a neck lift, but instead we're using a little guided fiber optic system to do that. I think it's a confidence factor, also just a vitality factor. I think so much of what we do in facial aesthetic surgery is all about vitality. If you can express a person's inner vitality, then you've done something really nice for them.